We have a very special episode for you tonight with Dr. Anil Maheshwari about stress and sleep and how they can affect our weight. Before we get started, though, tell me in the comments where you're watching from and let us know if it's your first time joining us. Dr. Maheshwari, thanks so much for being here with us tonight.
Oh, thank you for having me.
So let's start off by talking about a few of the environmental factors that have been shown to play a role in obesity. Tell us what those are.
Yeah, so environment is one of those things that most people don't even think about as playing a huge role in, let's say, things like obesity, but it plays an enormous role and on so many different levels. So let's start with the macro level. For example, we know through data that the United States has a much higher obesity rate than other countries. Canada is a little bit behind, and then Europe has the lowest in the developed world, let's call it. Why is that? That's all because of environment. I mean, if you think about it, the United States has large portion sizes. People are commuting from point A to point B in a car. There's less walking built into their lifestyle. And so we have a little bit less here in Canada. I mean, we have a little bit more walking, a little bit more public transport, all of those kind of things. Our portion sizes are a bit smaller. Processed foods may even play a role. Ultra-processed foods are even higher in the United States. So, and then when you go to Europe, there's more and more regulations on food. The public transport is a huge deal there. Most people don't have cars that they go from point A to point B with. So all of these things that we don't even think about affect our weight. And then on a more micro scale, who you live with, where you work, make a big difference. So if the people around you are more supportive, if there's less food everywhere, you're less likely to have the issue. So all of these factors kind of play in. So environment has a huge role to play.
So if we're living in an environment that perhaps doesn't encourage a lot of physical activity or where ultra-processed foods are more prevalent, it's almost like we have to work harder, be more conscious of the choices we're making just to kind of keep up, if I'm hearing you correctly.
Absolutely. That's exactly what I'm saying. And as time has gone on and the decades have changed, the environment has gotten harder and harder to deal with. So, for example, in the 1970s, portion sizes were much smaller. We had to walk more for doing things. There's just more activity built into our day. Now, we are in an environment where you can order food off of your phone. It'll come straight to you. It'll be delivered. You can keep working all the time. Work leads to stress. There's all these other factors that come into play. But absolutely, we have to work harder and harder today than ever before.
So stress is such a constant in so many of our lives. Tell us how stress can make it harder to lose weight and keep it off.
Stress plays a huge role in weight management. We know it has multiple effects physiologically, but also psychologically. So let's start with the physiological side. We know that, for example, acute stress can sometimes affect your sleep. And when you don't sleep well, then your ghrelin levels go up, and ghrelin is a hormone that increases your hunger. And then your leptin levels go down, and leptin is a hormone that increases your satiety or your fullness. So if your hormones are making you more hungry, then you're more likely to eat more. And so acute stress can have that effect. Chronic stress can raise your cortisol levels. Cortisol is a hormone that causes you to store fat, especially in the midsection area. And so that combination is not helpful. And then you take the psychological side. When we're stressed, what do we want to do? We want to kind of reduce that stress in some way. And the easiest way often is food. Food does help you to feel better temporarily, no doubt about it. That's why we often have issues when we're stressed or bored. We eat, and it makes us feel better. And so the combination of all of those factors can cause you to gain weight.
So we do hear from a lot of people that they turn to food when they're feeling stressed. What are some alternative coping strategies you might suggest they try at home?
Other ways to deal with stress other than eating is finding something. I always like to ask the question to the patients, like, what else makes you feel good? What do you like to do? And so we'll often go through a list of things. I do find that watching television or being on a screen is probably not the answer. And so I encourage people to look at, what are your hobbies? What gives you joy? What can you get lost in for hours? That's the thing that's probably going to help lower your stress levels. The other thing that will do it is socializing, taking some time to call a friend or go for a walk with somebody. These kind of things can also help lower stress. They don't come immediately to mind because food is so much more accessible, but they should be things we should work on all the time. And then the one that I like the most is actually exercise. Exercise can help you relieve stress to such a great degree. We know its physical benefits. And I remind people to think about when they exercise, does it help with their stress levels? And most people will go, oh yeah, it does. And so we sometimes just need that reminder that exercise, most of us don't love exercise. We love the side effects of exercise. And so lowered stress is a big one.
I feel like the theme of this conversation may be something along the lines of being more intentional with our choices. And what I hear you saying about, TV and phones not being a great choice for dealing with stress, it's almost like we have to be really intentional about what we're going to do instead. We have to do some planning because I think TV and devices after dinner at night is really the default. And so we've got to just really think, okay, what am I going to do tonight instead? Because otherwise we'll just slip right into what we're used to doing.
Planning is one of the most important things we can do to make any kind of behavioral change. It takes a lot of work up front, but it's worth it down the line if you can get into a new habit, for example. What we often do is we don't plan it out, and then, like you said, we fall into the default. And the number one default that I seem to see as a common thread is after dinner, between dinner and nighttime or bedtime, we will often do different things. And the number one thing that I see is people will often sit in front of the television. And with the television often comes the cues for food and just the habits of, I need something to munch on while I'm watching television. So making a plan and then making that a new habit is really important. But yeah, in the beginning, it takes a lot of thinking it through and planning ahead.
I love that you say, like, at the beginning it's the hardest, because once that new habit gets established, once you've watched some TV without food for a few days, then it's kind of like that association between TV and snacks sort of goes away. How long, in your experience, if someone can just stick with it for a week, a couple weeks, how long does it take before that new habit becomes more second nature?
I think it varies to a great degree. It depends on the person and how strong maybe the hormones are in their body, how long they've been in a particular pattern. So there's different stages that I walk people through. So for example, if they're watching TV, they usually watch TV from this exact same spot on the couch in the same room, and they've been doing it for years. And so we'll often say, okay, try sitting in a different spot and see if that makes a difference. Do your cravings simmer down? For some people, that works. For other people, try watching television in a different room if you can, and you may not get the same cravings. For other people, it's, well, maybe we need to switch up the activity. It's the television that is linked with the food, or the screen time that's linked with the food. How about we switch to a different activity, like reading or a hobby? There's just so many things. It all depends on the person. Some people just have really strong hormones and habits that guide them towards food. The stronger that all is, the more of a drastic change you need to make.
We're going to pause here and do our trivia question. Folks, if you answer tonight's question, you will get our awesome guide to superfoods, along with some great recipes that utilize them. And you'll get that guide for free if you answer our trivia question, which is, Honeycrisp and Macintosh are varieties of what fruit? Is it A, apples, or B, mangoes? Put your best guess in the comments, and you will get that superfoods guide delivered to your Facebook Messenger inbox. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. So many people tell us that their biggest struggle is with feeling tired all the time, which can make it really hard to make healthy choices. What would you want someone who's feeling this way to know?
Fatigue is a common issue for many people, especially in today's world. We have more stress than ever, we have more screen time than ever, and we are sleeping less than ever, it feels like. So one of the first things I'll address with fatigue is I want to rule out some of the more serious causes. So I'll often ask about the sleep apnea type questions. How are you sleeping at night? Has anybody ever mentioned that you have gaps in your breathing? Do you ever wake up gasping or choking at night? And are you sleepy during the daytime are three of the big questions I'll often ask. And if you're answering yes to any of those, you might want to talk to your doctor about, or your healthcare practitioner about, whether you should get a sleep study. And so if you can rule out sleep apnea, that's very important. The other thing that can bring on fatigue that we have to think about is, are you depressed or do you have anxiety that that might be causing the fatigue? So if there's any doubt about that at all, it's a good idea to, again, see your healthcare professional, get a screening done that will be able to tell you, is this a big issue for you or not? And so if you rule out those kind of issues, then you're left with things that you can work on your own, which would be, for example, I think in today's world, one of the most common things is that we're spending way too much time on our devices. So we're on social media, we're watching and streaming content all the time from our phones, from our tablets, on our televisions. And there's just so much entertainment out there. So oftentimes we'll go later than we want into the evening, and then we're squashing the amount of time we're able to sleep and recover. And so one of the biggest tips I can give is make sure you turn off your devices at a certain time before you go to bed. We also know that the blue light from devices also makes it harder to sleep well, and so there should be a gap between when you're going to bed or when you want to go to sleep and when you turn off your devices. So I would say devices are a big thing that is contributing to fatigue. The other thing is, I would say sitting. We're sitting more than ever, and whether it's on a device or for work or commuting, sitting is, you may have heard the term sitting disease. Sitting disease, I think, it's a clever term, but I think it's a real condition. We know that after sitting for a couple hours, your blood pressure goes up, your cholesterol goes up, your sugars go up, everything rises. It's not good for you. That's on the metabolic level. On the physical level, we all know how we feel when we sit for too long. Our shoulders hurt, our lower back can hurt. And so it's important to break up sitting. I think that can help a lot. But on top of that, we also need to have a separate time during the day where we might want to exercise. And exercise is very counterintuitive. You think, I'm too fatigued to exercise. But in reality, that exercise helps re-energize you. Now, not every form of exercise might be for you. Some of them might fatigue you more. But it's important to find the type of exercise that doesn't make you more fatigued, but does make you feel better, gets your body moving again, and the right hormones are coming back into your body. And if you find that that exercise makes you feel better, you will find that the fatigue level will often drop. So less screen time, more movement, less sitting, and then also exercise separately. These are three big ways to combat fatigue.
I'm so glad you suggested that, someone explore different exercise options to figure out what's right for them, because I think sometimes we overestimate how intense exercise has to be to see any benefit, when really a 15-minute walk after dinner can make a huge difference for our health, right?
That is absolutely true. We overestimate how much exercise we have to do to get a benefit. Walking alone gives us such enormous benefits. Cultures around the world have talked about walking after meals for as long as we've existed. And it's like we intuitively understood that if you walk after a meal, it'll make you feel good. It'll help with your digestion. That's what you always hear from elders, that if you walk after a meal, your digestion will improve. Probably a lot of truth to that. And we know if, for example, someone has diabetes, if you walk right after a meal, you're going to bring down your sugar level quicker than if you were to sit and watch TV or you were to sit on a screen or anything like that. So these little things do add up. I agree with you completely. Walking is a great form of exercise, but anything that's even any mild even just movement is so much better than sitting. So don't underestimate the power of movement, let's put it that way.
So many people have questions about metabolism, how it works, and whether it's possible to boost our metabolism. What would you say to them about that?
Yeah, this is one of the most misunderstood concepts in all of weight loss medicine. So when we lose weight, we're actually decreasing our metabolic rate. That's always the case. And the more muscle you lose, the faster the metabolic rate comes down. So it's important to, of course, focus on, when you're losing weight, to focus on fat loss rather than lean tissue loss. So by making sure you exercise and doing all those things, that can help decrease the amount of muscle that you lose. But remember, if you lose weight, your metabolic rate is likely going to come down, and that's okay. We just have to adjust for that.
So it sounds like strength training is really key if we don't want to be losing too much muscle as we're losing weight. Anything else that we can do to kind of preserve that lean muscle mass?
I think one of the things that we can do is increased walking. So if you think about if you're losing weight, what muscles in your body are doing the most work? Your legs, to carry you around. Now, if you lose weight, they're doing less work. And so your leg muscles will tend to shrink. What's the best way that you can counteract that? By increasing the number of steps. So even though your quantity of exercise per unit time has gone down, you just increase the amount of time that you're doing exercise. So I think walking is a excellent way to keep up the muscle mass, especially in the legs.
So a lot of people have told us that it's their family that can be the hardest challenge for them when they're trying to lose weight and keep it off and stick with healthy habits. How do you help your patients kind of figure out these challenges at home?
This is one of the most common issues and one of the hardest issues to deal with. When you don't have a supportive family at home, it makes it a lot harder to lose weight. It's the equivalent of, let's say, you're smoking and you want to quit smoking. If your partner is smoking and does not want to quit smoking with you, your odds go down tremendously. So I think that the same holds true when you're trying to lose weight. If nobody around you wants to make changes in the environment, it's going to be very hard for you to make those changes. That's not saying that there aren't things that can't be done, but the first step is to speak with the others and see if you can get their buy-in and explain to them why it's so important and why it might be good for all of us to eat better and have better eating patterns, let's say. But if they're not buying in still, you could probably, if it depends which side of the fence you're on. If you're the one preparing the meals, you have more control over the situation. But if somebody else is preparing the meals for you, then of course you have less control of your environment. It does become a very difficult situation in that place. But if you're the one creating the meal, you have a little bit more control of the situation, and there are certain things you can do, but you want to be careful not to make too many changes at the same time. Otherwise, you're going to have a revolt in your house. So you want to gradually change things to the way you want them. Most likely, your home didn't get to the point where it's at right now overnight. These changes gradually crept in, maybe more junk food and more eating out and more unhealthy foods, let's call them. If you're able to tweak one little thing at a time, nobody will notice. So it's very important to do it very slowly. Just don't make wholesale changes, and you might do better off that way.
In case you're just joining us, we're here with Dr. Anil Maheshwari talking about stress and sleep and how they can affect our weight. If you answer our trivia question tonight, you will get our awesome guide to superfoods that includes some delicious recipes. All you have to do is answer our trivia question, and that question is, Honeycrisp and Macintosh are varieties of what fruit? Is it A, apples, or B, mangoes? Put your best guess in the comments, and you will get that guide delivered to your Facebook Messenger inbox. Folks, we do this show every month, and we want to make sure you never miss an episode. Text the word WATCH to 844-966-1957, and we'll send a short text message to you reminding you when we go live each month. So what would you want folks watching at home to know about how a physician can help on our weight loss journey?
Nowadays, you have more options than ever to help you lose weight. And a lot of those options come through a physician or a healthcare provider. So it's very important to find a healthcare provider that can help you, because unfortunately, we're still not at the stage where all healthcare providers are on the same page, where they view obesity as a disease, where they view all the treatment options openly. For example, in Canada, we have the Obesity Canada Guidelines. And so the Obesity Canada Guidelines talk about nutrition and exercise as still being two cornerstones of healthier lifestyle and leading to weight loss. But they need to be supported, because we've been giving the same advice about moving more and eating less for 40, 50 years now. And meanwhile, the report just came out recently that there's now over 1 billion people worldwide with a BMI of over 30. So we are losing this war. And it's because we're giving the same old advice and it doesn't work. There's so many biological factors and psychological factors at work here. And so finding a physician to help is really key to this whole process, because there are more options available today than there have ever been. And I think in the next 5 to 10 years, we're going to see more and more options come available. Obesity treatment is no longer what it used to be.
So you mentioned we have more options than ever for obesity and weight management. What are those options? If I go to see a physician, what are the treatment options they might be able to provide access to?
The treatment options that are available are all based on the Obesity Canada guidelines. So you've got the 3 pillars that will support nutrition and exercise. You've got the psychological or behavioral change component. That's the first pillar. And so a physician can help you, a nurse practitioner can help you, often a dietitian can help you. So there's lots of providers that should be able to help you with that piece. The next piece is medications, and there are more medications now available than ever before, and they're more effective than they've ever been, and there'll be many more coming out in the next 5 to 10 years. So that's a very exciting piece. And then the third piece is, or the third pillar is surgery. For some people, surgery is the right answer. Especially the more health conditions you have and the more obesity is affecting your life on a daily basis, the more you want to think about things like the medications or even the surgery. It's at the end of the day, it's all about feeling better and having better health, having a better health span and lifespan. This obesity does affect both.
So the number one question we get about medications is, am I going to have to be on them forever? When your patients ask you that, what do you say?
That is a question that I get asked often. And the answer that I like to give patients is most people are likely to going to need this medication long term. Think of it just like any other medication for any other medical condition. If you have diabetes, we're not going to treat the diabetes until your sugars are under control and then say, okay, stop the medications, you're good now. No, because we know what happens when you stop the medications, the sugars go back up. We know the same thing happens with blood pressure and cholesterol. So with obesity, there are similar forces at work. We can help you get to a lower weight by a variety of agents. But once we stop the agents, oftentimes things will go back to where they were. The body will create these hormones that will make you more hungry and drive you back to your original weight. It doesn't like to see any weight loss, quite honestly. But there are people that are able to stop the medication, and that's important to know as well. I find the classic example is somebody who can make huge lifestyle changes. For example, a busy executive that then retires. All of a sudden, they don't have the stress level. They're sleeping better. They have time to dedicate towards working out. They are oftentimes able to come off of the medication. Or another example that we've had in our practice is people that have been doing shift work. We know that shift work makes it harder to lose weight for sure, especially working at night. So once people switch to a day job, unfortunately, not everybody has the option for that. But if you do have that option, then you're able to, oftentimes you're able to decrease the medications, or we've had some people come off of the medications. Whatever changes you make, you want to make them in a sustainable way. If you make big wholesale changes where you're going on some really restrictive diet, it doesn't tend to last very long. Yes, you can lose a lot of weight, but is that going to work for you long term?
In general, when you're working with your patients, how do you encourage them to think about their expectations, kind of where their weight is going to end up? How do you walk them through that?
So the first step is that we talk about all the benefits of weight loss rather than just the number on the scale. So we get them to look at their blood work and their how they feel, how they're breathing, back pain, knee pain, all of those kind of things. And with weight loss, you generally see a lot of things improve. So we keep trying to shift the focus to the other health benefits of weight loss. But the question does come up often is how much am I going to lose? How fast am I going to lose it? And the answer to that is so complicated because of how the medications affect different people. So depending on your genetics, some people, the lowest dose of a medication will lead to a significant amount of weight loss. Other people, the first dose doesn't even touch them. The second dose, as we move up, still isn't really affecting them. They need much higher doses. So genetics will influence how much weight you can lose on an agent. And then depending on how many lifestyle changes you can make, that's also going to influence your weight loss. So we like to tell people that we really can't tell you what weight you're going to get down to. We do know that you're going to get to what we call your best weight. And so your best weight is the weight that your lifestyle and these medications will allow you to get to. And as you make more and more lifestyle changes, that best weight will decrease. And if you use higher doses of medications or you use medications that are more effective for you, that best weight will decrease. But we can't give you a hard number and we can't tell you how fast it's going to happen either. And so we try to set up those realistic expectations.
So can being proactive about trying to reach a healthier weight now potentially reduce our risk for future health issues?
Absolutely. Losing weight now, before you have any health issues, can help you prevent those health issues. We know, for example, when you gain weight, insulin resistance tends to rise. And if you let insulin resistance go for a long time, what happens? Your sugars start to rise, and then eventually you go into prediabetes and then diabetes. The same thing happens with heart health. The longer of a period of time that you're putting a strain on the heart, the more issues there are going to be, the more potential issues there will be with heart disease. So if you're able to lose weight now and then save all that work, that extra work that the heart had to do for years to decades, it's going to make a huge impact.
So for the men watching at home who may be concerned about a heart attack or a stroke down the road, losing weight, getting to a healthier weight now really could prevent that.
Absolutely. Losing weight will put less of a strain on their heart long term. But also we know that with weight gain, we often see cholesterol levels and blood pressure levels and even sugar levels all start to rise. These all take a toll on the heart as well in the near to moderate future, and then long-term future, 100%. So weight loss is one of the best ways to combat all that. And do it, the earlier you do it, the more proactively you do it, the better the results.
So what are some of the things that your patients tell you that seeing you has helped them with, that they're kind of surprised by?
In our weight loss program, we hear all the time that people are surprised by the amount of energy that they get when they lose weight. They were expecting improvements, but it's quite amazing what happens. And I think part of that is the physiological part, but part of it is also the mental part. One of the things we hear about when people come in initially, within the first few months of starting on a weight loss plan, and if they're successfully losing weight, they will often say, for example, if they're on a medication, they will often say, it feels like a 50-pound weight is off of my shoulders. And I'm not thinking about food all the time. And this is amazing. I have more energy for so many other things. And so that is the thing that I think that they're the most surprised with. Just the fact that they didn't realize how much energy was being put into thinking about their weight constantly.
So we've heard from lots of people that when they're on medications, they suddenly find themselves thinking less about food. Cravings go away. Why does this happen?
A lot of the cravings that people have over food are hormonally related. And so there's cravings pathways in the brains. There's gut hormones that come up to the brain to signal that you're full or you're hungry. When we use medications, we are either changing the cravings in the brain or we're changing these gut hormones that are coming to tell you that you're full and or telling you that you're hungry. And so by changing what's going on in your body, it automatically just makes it so much easier for you not to be thinking about food or craving food or thinking about food all the time, basically.
Well, I feel like so many people feel like their cravings are just a lack of willpower. But what I hear you saying is cravings are really driven by our brain below our level of conscious control a lot of the time.
Yes, a lot of the time our cravings are controlled by biological drives. I mean, if you think about it, we evolved to find food and survive. And so at one point when food was scarce, we looked very hard for it, and whenever it was there, you ate it because you never knew when you were going to get it again. And you conserved energy. You didn't do any exercise on the side because you needed to look for food. In today's environment, food is so easy to find, and our drives are still the same. If you see food, maybe you should eat it. And don't exercise because that's just a waste of energy. But in reality, today we need to exercise more than ever because it's not built into our lives anymore. And food is readily available everywhere. And so we need to figure out how do we not eat that food, go with our biological drives and eat that food all the time.
Last question about medications. Again, there's so much hype in the media about them. Are they a cure for obesity? Is it just we take the medication and don't have to think about it anymore?
The short answer to that is no, absolutely not. The reason being that these medications work better for some people, not so well for other people. But even if they work really well, it's so important to work with somebody to make sure that you're getting enough protein in your diet and fiber and the important parts of your diet. And also exercising, because with weight loss, we will often see a lot of muscle loss if you're not careful. So if you just take the medication, and in some people, for example, the medication will make them feel not hungry. And so they'll skip meals and they eat very little. Now, when you lose weight rapidly like that, and you're not exercising and you're not getting your protein, you are going to lose more muscle mass. And we've had people, we track muscle loss very carefully in our program, and we've had people lose more than 50% of their weight from muscle if they're not paying attention to all the things we talk about. And then we've had other people lose less than 10% of their. Unfortunately, you always lose a little bit of muscle mass when you're losing weight, but it's very important to pay attention to these other lifestyle factors so that you don't lose a larger amount of it.
And why is that? Why is losing more muscle mass a challenge?
Well, muscle mass is probably one of the healthiest things we can have. As we age, as a matter of fact, we know that as we get older, unfortunately, we do lose a little bit of muscle mass every year. And so a lot of the things that we see in the elderly are from what we call sarcopenia, too much muscle loss. And so they become, their walking is not normal, the balance is off, and these are all related to muscular changes. So it's important to hold on to as much muscle as we can, because that's what helps us function. That's what helps us have a good health span, meaning that while we're alive, we are living well. And then it also does improve our lifespan, because if you're not falling, if you're able to do more activities till a later point in life, that's always going to help you feel better and live longer.
Dr. Maheshwari, thank you so much for joining us tonight. This has been a fascinating conversation.
Thank you for having me. It's been so great. You're doing great work.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. Honeycrisp and Macintosh varieties of what fruit? A, apples, or B, mangoes? The answer is A, apples. If you didn't get to answer the trivia question, but you'd still like that guide to superfoods, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.